A devastating blow. Trump halts HIV funding in South Africa. President Trump has ordered the immediate cessation of all USAID funding for HIV organizations in South Africa. Announced on February 27, 2025, this decision leaves millions of South Africans facing an uncertain future. Organizations received termination letters instructing them to cease all activities and avoid further expenses. The impact threatens to unravel decades of progress in the fight against HIV/AIDS. The funding cut affects PEPFAR, a key program providing life-saving treatment and care. Since 2003, PEPFAR has invested $8 billion in South Africa. These funds support vital health programs, including HIV testing, TB care, and services for key populations. The impact of this funding cut is already being felt across the country. Major organizations now face the impossible task of continuing their work without necessary resources. The sudden withdrawal of support has forced many to contemplate drastic measures, including staff layoffs and program closures. The situation is dire for those relying on these organizations for HIV treatment, risking drug resistance and a resurgence of the virus. Millions impacted, billions withdrawn. President Trump's decision halts USAID support, affecting 44 health projects in South Africa. These projects offer essential services like HIV testing and antiretroviral medication. The funding cut threatens South Africa's healthcare system. $440 million withdrawn, plunging organizations into financial crisis. The long-term consequences are severe, risking years of progress. A shift in priorities. The U.S. justification for funding termination. The Trump administration, in its official communication, states that the decision to halt funding stems from a reassessment of U.S. foreign aid priorities. Termination letters received by the affected organizations cite that the targeted programs are not aligned with agency priorities and not in the national interest. This justification, however, has been met with widespread skepticism and outrage from global health experts and civil society organizations. Many view the move as a politically motivated attack on crucial health programs that have been demonstrably successful in saving lives and curbing the HIV/AIDS epidemic. The decision to cut funding for HIV/AIDS programs in South Africa comes amidst a broader trend of shrinking foreign aid budgets under the Trump administration. This shift in priorities, critics argue, reflects a dangerous disregard for the health and well-being of some of the world's most vulnerable populations. Furthermore, the sudden and unilateral nature of the decision has been condemned as reckless and irresponsible, leaving organizations scrambling to adjust and potentially jeopardizing the lives of millions of people who rely on their services. Uncertainty and fear, the dire consequences for South Africa's vulnerable. The immediate consequences of the funding cut are already being felt on the ground in South Africa. Healthcare workers, many of whom are now facing the prospect of unemployment, have expressed grave concerns about the future of their patients.
Government has to cease the inaction. This cannot be allowed to happen again.
With organizations forced to scale back their operations or shut down entirely, access to essential HIV/AIDS services is becoming increasingly limited, particularly in rural and underserved communities. The long-term consequences of this decision are potentially catastrophic. Without access to testing, treatment, and prevention services, the rate of new HIV infections could surge, reversing years of hard-won progress. The increased burden on South Africa's already strained healthcare system could prove overwhelming, leading to a decline in the overall quality of care. Perhaps most tragically, the decision to cut funding for HIV/AIDS programs sends a message of abandonment to millions of South Africans living with the virus, instilling fear and uncertainty about their future. A call to action, the response from South Africa and beyond. The South African government has faced criticism for its perceived slow and inadequate response to the crisis. Civil society organizations, however, have been vocal in their condemnation of the funding cuts and their potential impact.
The Trump administration has declared war on the right to health globally,
stated Yvette Raphael of the AIDS Healthcare Foundation, encapsulating the sentiment of many working on the front lines of the epidemic. Organizations like the Treatment Action Campaign, or TAC, have called for immediate action.
These terminations mean death to poor people of the world. It is time for the world to speak up,
said TAC's Sibongile Tshabalala. The international community, too, has expressed concern and urged the U.S. government to reconsider its decision. The sudden withdrawal of USAID funding has been labeled as short-sighted and detrimental to global health security. As the world grapples with the implications of this decision, one thing is clear: the fight against HIV/AIDS in South Africa, and indeed globally, has been dealt a severe blow. The need for a coordinated, adequately funded response has never been more urgent.